Eric Hammer here, registered physiotherapist. Today, I'd like to continue with my theme of kind of giving advice to other physiotherapists about things that they might want to look out for in their own practice. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, what I wanted to talk to you today a little bit about is this concept of shoulder blade positioning for patients who might present with a shoulder pain of some type. So although shoulder blade positioning doesn't give us much information in and of itself, it can be helpful in terms of different tests or different things we might want to look at based on the observation of the shoulder blade. So for example, right, we might see somebody with a winging scapula of some type, right, where the shoulders are protruding outward and the shoulder blades aren't really flush to the rib cage area. So that, for example, might give us indications around different muscular weaknesses like the serratus anterior. We might see that the humeral head might be forward in some ways, right? So again, we could be looking at different muscular compensations, maybe overuse of the pec minor muscle, perhaps a weakness of some type, perhaps a really tight posterior capsule, right? So if we're tight in the back posterior capsule area, that might then bring that shoulder, the head of the humerus forward. That might impact us in some ways with, let's say, an impingement of some type. If somebody has an elevated scapula of some type, maybe they're overusing their upper traps, or maybe there's some weaknesses in terms of lower mid-trap stability, which might be causing some irritation in the shoulder. So the whole idea here is that although there can be patients who present with all sorts of different positions in terms of their shoulder blade initially, right, before we go into any sort of active range of motion, it can give us a little bit of information about what we might want to look at further, although shoulder blade positioning and positioning of the head of the humerus in and of itself doesn't give us much information. It can lead us to clues about things that we might want to look into further. So just wanted to give that as sort of a general reference point when we're starting to look at the shoulder as a starting point, as an area of potential hypothesis about what we might want to look at further. Thanks again for watching, and please leave any comments or questions below if you have any questions for me. And please make sure to check with a physiotherapist or a doctor to make sure that this or any other information is appropriate for you. Thanks again and have a great day. Take care.